So, you're an internationally trained physician, and you're thinking about practicing in Canada? Well, you've come to the right place. There's a clear, step-by-step journey to make that happen. In this explainer, we're going to walk through that exact roadmap, from your very first document all the way to getting your final license. Let's dive in.
And to really get why this matters so much, let's kick things off with a pretty staggering number. As of 2024, nearly a third, a full 31% of all family doctors in Canada were actually trained internationally. So this isn't some tiny, obscure pathway. It's a massive, vital part of our country's healthcare system. And if we zoom out a little bit, it gets even clearer. Data from Statistics Canada shows that immigrants make up a whopping 1 in 4 healthcare workers across the entire sector. This proves there's a well-established, absolutely essential path for you to follow. So where does a journey like this even begin? Well, the very first gate that every single internationally trained doctor has to pass through is credential verification. This is the part where you prove that all your years of hard work, your medical degree, it's all authentic and up to Canadian standards. Okay, first thing you need to do is go to physiciansupply.ca. Seriously, bookmark this site. It's going to be your mission control for this whole process. Think of it as your personal dashboard for submitting documents, signing up for exams, and, tracking all your progress. Once you're in and your account is set up, you've got 3 things to tackle right away. First, obviously, create the account. Second, you'll submit your medical degree and transcripts for something called a source verification request, or SVR. And third, if your documents aren't in English or French, you'll need to get them officially translated. So what on earth is source verification? Well, it's not just you sending in a photocopy of your diploma. The Medical Council of Canada actually goes and confirms directly with your home institution, your med school, that the documents you submitted are the real deal, completely authentic and unaltered. And here is a super important tip. Start this step as early as you possibly can. As Dr. Felipe Santos points out here, this whole back and forth process can take a long time. We're talking sometimes up to 3 months. So you definitely want to get the ball rolling on this one. All right, your documents are verified. Check. You are now clear to move on to the next big stage, the exams. There are 2 of them, and they're designed to assess both your medical knowledge and your clinical skills against the Canadian standard. These 2 exams have very different jobs. The first one, the MCCQE Part 1, is all about your medical knowledge and decision-making, your book smarts. You have to pass this one to get a license, period. The second one, the NAC exam, is more about your practical, hands-on clinical skills. This one's required if you're planning to apply for a residency spot in Canada. So what do they actually look like? Well, the MCCQE Part I is a full-day, computer-based test, lots of multiple-choice questions and clinical scenarios. The NAC exam, though, that's a whole different ballgame. It's a half-day practical exam called an OSCE, where you'll rotate through 12 different stations and interact with actors playing patients. It's all about showing what you can do. Okay, you've conquered the exams. Amazing. Now you've arrived at a really big crossroads. This is where you have to choose a specific pathway to get your license. And the right one for you really depends on your experience and your specialty. The first major pathway is the CARMS residency match. You can think of CARMS as a giant national matchmaking service that connects doctors to residency programs all over Canada. This is the go-to route for doctors who need to complete a Canadian residency, maybe because they're a bit newer or their training isn't directly transferable. But what if you're already an experienced doctor who's been practicing for years? Well, that's where the second path comes in, the Practice Ready Assessment, or PRA. This is a fast track designed for you. Instead of redoing a whole residency, you do an intensive 12-week supervised assessment to prove you're ready to go. Now, it's really important to know that it's not just those 2 options. There are other, more specialized pathways too. Some specialists might use something called the practice eligibility route. And hey, if you're a family doc from the US, the UK, or Australia, you might even be able to get certified without an exam. The key takeaway is to do your research and find the specific route that fits you perfectly. All right, you've picked your path. You're on your way. Let's talk about the final stretch. How do you actually cross that finish line and get your license to practice? This timeline here lays out the final sequence beautifully. After you pass that MCQE Part 1 and finish your training requirements, you get your LMC. Think of that as your national stamp of approval. Next, you get certified by your specialty college. And then, the final boss, you register with a province, and they grant you the actual license to see patients. And that brings us to an absolutely critical point you have to remember. In Canada, medicine is regulated provincially. So while a lot of these steps are national, that final all-important license to practice is issued by the medical regulatory authority in the specific province or territory where you actually want to work. So there you have it. We've laid out the entire map, from that very first document verification all the way to getting your final provincial license. It's a challenging journey for sure, but it's a well-defined one, traveled by thousands of doctors practicing all across Canada right now. The only question left is, are you ready to start your journey?